name is Todd Bro, President of Physicians Urology in the Center for Urologic Health, here for another episode of TalkNHealth. On today's episode, we're going to discuss erectile dysfunction. Erectile dysfunction, or the inability to get or maintain an erection, is an extremely common condition that we as urologists see on a daily basis. The causes of erectile dysfunction can be many, but generally have to do with aging as well as general medical conditions. Most men that present to me with erectile dysfunction have the condition begin in their 40s. As I mentioned, it can be an inability to get an erection sufficient for sexual intercourse or an inability to maintain an erection. There's a complex interaction, both physical as well as psychological factors involved in getting an erection. So the first step in the evaluation is to look at the patient's personal life, as anxiety and outside stressors can certainly play a role. And once we do that, then look at their overall medical condition. Things such as diabetes, hypertension, and high cholesterol all lead to erectile dysfunction. An erection is the penis filling with blood, so if the blood vessels supplying the blood become narrowed, just as they can become narrowed in the heart and other parts of the body, then you tend to have weak erections. The first line of treatment are medications which actually increase blood flow to the penis, and these are ones you're familiar with: Cialis, Viagra, and Levitra. If these medications are effective, that tends to be the only treatment that many men will need. If they're not effective, however, we have to go to some more invasive options, such as a vacuum erection device, intraurethral pellets called mousse, which can be quite effective, injectable agents, which are injected into the penis to attain an erection, and finally, surgery can be done to insert a artificial inflatable erection, which is controlled by the patient. Fortunately, these days, with the advent of the effective medications that we have, surgery is rarely indicated, but it is still an option. Another important factor that can lead to erectile dysfunction is hypogonadism, or low male testosterone levels. Just as women undergo menopause around 50 years of age, men also undergo a decrease in hormone levels known as andropause. Testosterone is responsible for sex drive and thus indirectly responsible for erections. We'll test testosterone levels and we'll find them low in many men, and testosterone replacement can often increase libido, increase sex drive, which as a result leads to more successful sexual encounters. The important thing is to realize that if you are suffering from erectile dysfunction, you certainly are not alone, and there are effective, safe rather, and effective treatments which can be explored and tend to be quite effective. If you're uncomfortable speaking with your primary care physician about it, we as urologists certainly, as I mentioned, deal with this on a daily basis, and would be more than happy to meet with you and discuss your options. My name again is Dr. Todd Bro, of Physicians Urology, and thank you for joining us.